The passing of a loved one is emotional enough without adding the stress of funeral arrangements. By pre-planning, you receive the desires of your heart while taking away the burden from your family. It also saves you money, providing the dignity and respect your memory deserves. And there are times when life ends unexpectedly. Please know that the New Pitts Mortuary is here to lend a helping, caring hand anytime, day or night. We are the New Pitts Mortuary.
To At the Table this morning. This is Karen Dotson from the All of Us Research Program at the Medical College of Wisconsin, and I have Dr. Kevin Izzard, who is a family practice physician. He's also
Yes.
co-investigator of the All of Us Research Program, also chairman of
The president of Cream City Medical Society.
and
That's our black doctors in Milwaukee.
yeah.
Yeah, you know what? I'm no longer the chair of family medicine over at St. Joe's. I decided to let someone else have a turn at it,
But you're
but
gonna try to
I'm
have
still
a little
involved with
bit
it
of a
though.
life, huh?
Yeah, yeah.
Okay, well, I understand because
Yeah.
you had a lot of things going on. Sometimes you need to sleep, right? And also you got to direct that choir, so got
Yeah,
to make sure you keep that
that's
in
right. The
mind. But
Lord gets his time.
I want to welcome people back. We have a conversation about research. Dr. Kevin Izzard has really talked a lot about that today. We're going to always bring that to you because he's going to also let us know some exciting things that are evolving, that are coming up, that are being discovered through research, and it's just so beneficial to us.
Right.
We have a special person on the line today,
Yeah.
and I'm excited because she is so special related to dermatology and skin and hair and our nails, but also other things that she is doing. So I would like to introduce to everyone Dr. Alicia Vaughn. And Dr. Vaughn, I want to welcome you today. It is so hard to pronounce your entire name, so I'm going to let you do that for everybody. But I wanted to make sure people are aware of what you do. Dr. Vaughn is an assistant professor of dermatology at the Medical College of Wisconsin. She grew up in Milwaukee. That's what I love about this. All three of us did.
Mm.
Attended Harvard University, played in a band in Los Angeles for 10 years. So Dr. Vaughn,
Oh, I didn't know that.
I'm curious about what instrument, and then returned to Wisconsin to go into medical school at Madison. Finally, she moved back to Milwaukee to serve in the community here as a dermatologist. Her areas of interest are genital disorders, transgender care, and global health. Good morning to you.
Good morning. Thanks for
Morning,
having me,
Dr. Vaughn.
Karen. Hi, Dr. Izzer. It's so lovely to I can see you both, so this is really
Oh, you can see it.
wonderful. Yeah.
Yeah. I know. Yeah, that's great. That's great. Dr. Vaughn, you and we were just talking about this earlier, Dr. Izzard and I. Are you the only Black dermatologist in Milwaukee?
No, there's two Black dermatologists in the state of Wisconsin. The other one is named Marth Dika, and she has a kind of a solo practice, and
Yeah.
she's wonderful. But isn't it kind of it's unfortunate that there's only two Black dermatologists in our state.
Yeah. Yeah.
Wow, I know, that when we brought you on, I was so happy that first of all, for you being able to be available to be on the show today, and also to talk to the community about how we should and what we can do for our skincare, our hair. So, Dr. Vaughn, I want to dive right into this, and I wanted to just ask you some questions as far as what are some of genetic related
Hey,
skin
before
and
you get into
hair?
that, I want
Yeah,
to hear
go
about this
ahead.
band. What'd you play in the band?
Oh my goodness. You weren't going to let that one slide, huh?
No,
I
I
love it.
wasn't.
Yeah, when I was in college, you can imagine my poor parents. Here I was, this Harvard grad, it was like spring break of my senior year, and they were sure I was going to go to medical school. And I
Mhm.
told them, I announced, actually, I'm going to go try out for this band and probably move to LA for a little bit. And they were just like, oh God, Um, and so after I graduated, I joined. I tried out spring break. I got in the band. I moved out to LA, and I stayed there for about 10 years playing in the band that I moved out there with, and I left that band and started my own band that I sang in. Because when
Really?
I first moved out there, I was the lead guitarist for a band.
Mhm.
And I didn't sing. And then after I'd been there for a while, I thought, I could front a band. Let me try this. Let me try being a front woman. So
Hmm.
I played guitar, keyboards, and bass, and then I sang.
What kind of music
Wow.
did you guys play?
It was indie rock. That
Indie
was kind
rock?
of the thing at the time. Everybody was out there in LA being an indie rocker.
Yeah. All
It was
right.
so fun. And
It's
so it is
it's
really
good to
sad
hear
right
people.
now.
Yeah,
Oh,
it's
sorry,
good
can I just
to
say, I
people
just
have
want to
life.
shout out to all my friends in LA who's, they're going through so much right now. And I really feel
Right.
for them. So
Mhm.
hi to all of them. And you're in my thoughts.
Yeah. Yeah. We have family out there as well, and we've been
Yeah.
checking with them, and so far so good. But
Yeah.
everybody doesn't have that story, so our
No.
thoughts and prayers are with everyone in
Mm.
LA as they go through this challenging time. So, Dr. Vaughn, as we talk about, skin and hair as it relates to people of color, um, can you talk about as it relates to genetics for us as well?
Yeah, yeah. I know that, MCW and Freight are really leading the charge with all of us and being part of that and trying to get our community involved in that. And I'm so grateful that that work is being done because we really do need the genetic information on people of color in order to grow this knowledge base so that we can serve our community better from a
Mhm.
medical standpoint. Um, as far as genetics go for skin and hair, we know certainly that genetics does determine, at least in part, various aspects of your skin and hair. So obviously things like hair color, if your parents had dark hair, you're much more likely to also have dark hair. But also things like oiliness, things like how the hair ages over time. So, at what age you're going to go gray, at what age you're going to start losing some hair, at what age your hair might feel more dry. And then certain skin conditions like eczema or psoriasis, things on the skin that if you're, I have a lot of patients who come to me and I'll say, oh, this looks like psoriasis. And they'll be like, oh, my dad had psoriasis and I didn't even put that together. So there's a lot of factors, there's a lot of genetic things, but then, there's also things that are just common to all skin as it ages. So there are these growths called seborrheic keratoses, and kind of almost everybody gets them, if not one, many. And that is something that is inherited too. And people always come in and, they'll be like, oh, now I got these like age growths on my back and my mom had so many and now I have so many. And I always joke, well, she probably gave you a lot of really good things too. But I also like to remind people that genetics is not absolute. It's not, it's not the end all be all of what determines your skin and hair condition. For example, those little brown bumps that people get on their cheeks, they're called dermatosis papulosa nigra. Sometimes they kind of hang off. They
Morgan
when you're
Freeman.
younger, people call them freckles, but then when you get older, they kind of stick out.
Morgan Freeman has them.
Yes, that's exactly what I always say. He's got so many of them. And
Yeah.
I believe, even though there's no scientific proof, I believe that that's because he lived in LA for so long as an actor and he had so much sun. So, when we were all, back when he was growing up in LA, I'm sure that sunscreen was not as big of a thing as it is today. And so he probably was never really wearing sunscreen. There used to be that myth that Black people didn't need to wear sunscreen. And so I think he got a lot of sun. And I think that might have contributed to why he has so many of those.
Interesting. Yeah. So I know, with especially with women, black hair is its own thing. And so you go to to a white doctor, and I don't have experience with with dealing with black hair. So how do you approach women, especially who are maybe losing their hair, or their hair is breaking, or they have questions about getting their hair processed or relaxed? What are your conversations with your patients about that?
This is such an important question, Dr. Izzard. I think because there are so few Black dermatologists, just in general. It's under, the percentage of Black dermatologists is below the percentage of Black people in America. So kind of we're underrepresented as dermatologists. So I have a lot of the patients that come to me who have brown or Black skin say that they sought me out because they wanted someone who would understand their skin, someone who would understand their hair. And I do want to kind of give a little bit of a shout out to my colleagues who are not people of color, but who really dedicate themselves to studying skin of color and hair of color so that they can understand it and provide good care. So I want people in Milwaukee to know that they don't have to have a Black dermatologist to get good dermatologic care. That said, there are some things that some knowledge they need to be empowered with so that they know to go in and ask the right questions and kind of say the right things. One thing that just breaks my heart is when women of color have been told that, that their hair, just go put some moisturizer on it, or that their hair is not a problem, that the thing that they have is not, it's just normal with getting older, or it's something they did to themselves, like they use a certain kind of product or a certain kind of hairstyle that caused their own problem. And I just think that's a real injustice to people. I don't think it's accurate, and it causes a lot of negative emotions that don't need to be there. But there is such a thing as traction alopecia. So let me go back and explain those words. Alopecia is a broad term. So people have heard of alopecia because of, Jada Pinkett Smith and, people in the limelight that they may have seen with, losing their hair. And there's a lack of understanding that alopecia is an umbrella term. And there can be a lot of different reasons why you have alopecia. If you go through chemo and you lose all your hair like we see in the movies, that's alopecia. If you are in a fire and you're burned and you lose all your hair, that's also alopecia. And then as you're getting older, you may lose some hair, and that's called androgenetic alopecia. All of those are different. There's so many kinds of alopecia. So just to say, like, I think I have alopecia, well, you're not saying that much yet. But then when you start to dig down into the kinds of alopecia, that matters. And so traction alopecia is when the hair is getting pulled and it just kind of gets tired of being pulled so much, and it just gives up and it will fall out. And so it's important for especially Black women to know, but also Black men, to know that there are certain kinds of hairstyles that are higher risk for alopecia, so that they can, if they're losing hair, they can start to try to avoid those hair types. So, some of those high risk hairstyles include anything that is tight on the hair. So box braids, tight cornrows, even sadly sister locks, which is the kind of hair that I have, sew-ins or extensions, things that put additional weight on the hair, and even like a high ponytail or a high bun, depending on how much hair you have. If that is kind of pulling the hair back, then that can be pulling on the hair too hard. So if you feel like you're losing hair, especially like kind of along the frontal hairline, it's important to stop any hairstyles that are pulling on the hair. And one way to know is if your hair hurts after a certain style. So, like when I was a kid, I used to get box braids, and the Nigerian women did it. And those Nigerian women, they will pull on your hair like nothing. Like, it is so brutal. And so the next like couple days, your scalp was just sore, like it just hurt. And that's a really bad sign. So if you're going and getting, your sister locks tightened, you're getting box braids put in, you're getting a sew-in, you are wearing your hair in a ponytail all day, and at the end of the day, you take it down, and it kind of hurts, and you just have to rub that head. That's too tight. The hair does not like that. So then you have to loosen that up.
Is that reversible? So
Right. That's what I was
if
just
you get rid of
wondering.
the braids, or does the hair come back?
It depends on a few things. Some of that is genetics, and some of it is how long the hair has been pulled for and how much damage has been done. So traction alopecia early on is considered reversible, but then after so much damage, after so much time or repeated trauma, then it can become a scarring alopecia. And that's like a separate category of alopecia. That's where the hair follicles are replaced by scar, and then that is permanent.
Yeah. So we needed to do a biopsy to determine that.
Yep. So that's the other thing I think. Yeah. Oh my gosh, Dr. Izzard, do you want to come with me and do my dermatology clinic?
Yeah, this is like
As a Black doctor, you can't get away from dealing with these things.
That's but yes, that's what I think a lot of people don't know too, is that there is a role for biopsy. There's a fascinating study that came out within the last couple of years, and it talks about specifically Black women who have alopecia and what happens when we biopsy those women. And the findings were kind of shocking, in that more than half of women, if they get a scalp biopsy, it will change the management of their condition. Like, it will change what the doctor does. It will change what the diagnosis is. And the kind of way that goes for people listening is that, imagine a woman goes in to see her dermatologist. She's like, I'm losing my hair. And the dermatologist looks at it and says, well, I think it's probably age-related hair loss or traction alopecia, or even I think it's this kind of scarring alopecia, and gives some treatments. But they don't necessarily do a biopsy, and I don't either. We don't always have to biopsy alopecia. Sometimes we can look with our magnifying lenses and figure out what it is. But the fact of the matter is that more than half of the time we're wrong. And if we did a biopsy, we would find out some information that could change what we do. And more often than not, that is that we biopsy and discover that, in fact, that hair loss is scarring and age-related, or scarring and traction, that there's multiple things going on, and that we missed the scarring component. And that is considered a hair emergency, because once those follicles are scarred, they are gone forever. You cannot grow that hair back. Then your only option is hair transplant. And so we try to intervene before, like if there's scarring alopecia, we try to be really aggressive. So sometimes you need a biopsy to confirm that that's what it is.
Mm-hmm.
So I have a question as far as related to when people lose hair as they get older, women and men. Is there some kind of reverse on that, or something that can happen to bring back hair? You see so many different commercials and so many products out there.
Yeah.
Rogaine being one of the big ones.
Yep, absolutely. Well, so when people are losing hair, there's the scalp, the skin of the hair, and then there's the hair itself. So, I mean, the first thing to know is this is when you're losing hair, is it truly a scalp problem? Is it a skin problem? Or is there something wrong with the hair? And that can be, that there's a lot of breakage, that the hair is not healthy, that you have a vitamin deficiency. So that, if your hair is breaking a lot, that can be different than a skin problem where you're losing the hair because like the hair at the root is not growing properly. And and that again is so what we call multifactorial. There can be so many reasons why people are losing hair like that. But that said, and there's one other thing about that, which is if you are losing hair as you get older, kind of gradually, some of that can be normal. And it's always important to know what's normal and what's not. And some hair loss as you age is normal, but that should never be itchy. And using that itch is a good way to distinguish between, like, to tell if there might be a problem. If your scalp is very itchy all the time, then it's probably good to address that with your primary care doctor first and maybe even see a dermatologist. And then if your hair is, not itchy, there's not a problem there, maybe it's falling out just age related, there are interventions that we can do. So, Dr. Izzard, you were very astute to say, what about Rogaine? That is usually our first line therapy, which is minoxidil is the name of that ingredient. The generic is just as good as Rogaine. Well, I shouldn't say just as good, but they are the same thing. So it's kind of like, are you the kind of person who likes brand name things versus the generic things? Like, will you only buy Kleenex and not just buy the cheap tissues, But they both can wipe your snot, So it's kind of the same for minoxidil. Like, if you want to get the Rogaine, feel free. But minoxidil is the ingredient, and it will regrow some hair. People always want to know, okay, if I start that though, do I have to do it forever? And the answer is yes. The minoxidil will grow up some hairs, and then if you stop the minoxidil, not 100%, not all the hairs will fall back out, but a proportion of them will. Oh, is that my cue to stop talking? I hear music.
No,
We have to
no,
go to a
actually,
commercial break.
we are going to have to take a break. We have a couple callers on the line.
Oh,
We will get back to them, Dr. Vaughn, in a couple of minutes. So we're going to ask people to join us. This is Dr. Vaughn. She's a dermatologist from the Medical College of Wisconsin. We're excited that she's with us today. Dr. Kevin Izzard, family practice physician, is joining me, and I'm Karen Dotson from the All of Us Research Program. Please feel free to come and sit at the table with us. We'll be back. You can reach us at 414-444-5250, 414-444-5253. We'll see you on the other side.
The passing of a loved one is emotional enough without adding the stress of funeral arrangements. By pre-planning, you receive the desires of your heart while taking away the burden from your family. It also saves you money, providing the dignity and respect your memory deserves. And there are times when life ends unexpectedly. Please know that the New Pitts Mortuary is here to lend a helping, caring hand anytime, day or night. We are the New Pitts Mortuary.
Dotson from the All of Us Research Program at the Medical College of Wisconsin. I have Dr. Kevin Izzard, who
Good
is with
morning.
us as well, family practice physician, also co-investigator for the All of Us Research Program, and also Dr. Vaughn, a dermatologist from the Medical College. Dr. Vaughn, we have some callers on the line, and we're going to welcome our callers at this time and see what they have to ask our dermatologist today. Good morning. You're at the table.
Yes, good morning. I was just listening to the dermatologist and talking about hair. And there's been rumors floating around the circle, and there's been nutrients and things like that people have actually tried. What about reversing gray in the hair? Have you? I'm sure you've heard of that. There's certain nutrients or something that they've tried to use or that they've come forward with to actually reversing gray in the hair. And then I had a question for Dr. Izzard too. But go ahead.
Okay,
All right.
Dr. Vaughn, he has a part two question. Go ahead, Dr. Vaughn.
Yep, I wish that I had a better answer for you. I'm going gray too. I mean, my grandma always said, "Don't let yourself go gray," but I'm just aging naturally. I'm aging gracefully. Science has not yet discovered a way to stop the gray. We do think that some things contribute. So some people are genetically encoded to go gray sooner. Some people go gray, very young ages. Some kids go gray. And so we know that there is like some kind of genetic factor at play there. Some people go gray after chemo. Some people go gray when they're under a lot of stress. And so, we could try to look into, science could try to look into that more and figure out a way to kind of like turn those genes off. But nobody, as far as I know, nobody has done that yet. But, whoever figures that out is going to make a lot of money. So I'm sure that some smart person will do that.
Sure will.
So it's not true that it's an inefficiency. It's inefficient. It's an inefficient something that's going on in the body that you're deficient with.
Like a vitamin deficiency. Right.
Not necessarily. There are some, it's very complicated, but there are some conditions that could cause you to go prematurely gray. So if you're kind of abnormally going gray all of a sudden, especially at a young age, and it's not kind of a normal aging gradual process, then you should talk to a doctor about that.
Okay, alrighty. Then to the Dr. Izzard.
Mm-hmm.
I was listening earlier, and you were talking about the coming in and doing the trials.
Mm-hmm.
Do you think that that's a great thing to push in our community after we was just pushed with that COVID shot? And then you have to realize something, that the last actual legal sterilization, where they were sterilizing people, in some cases, people weren't even knowing that they were, when they gave birth to a child with these vaccines, that these people were being vaccinated.
Mm-hmm.
I mean, being sterilized. The last sterilization, the last legal one, because this was legal, okay? The last legal one was in 1985, but then they tried to continue it over in Detroit and got busted over there. And that's one reason why I put back on some of the birth control and stuff like that, because a lot of times we don't know what we're getting ourselves into. I have some friends that are basically really sterile, can't have kids, and I wonder, did it have anything to do with them going to suburban night schools, taking the vaccinations?
Right.
So with the COVID shot, man, do you think it's cool to actually push going in, sending our people in as guinea pigs? And I'll take your answer off the air.
Okay. You know what? We got two options. One is we don't get involved with these things. We don't do any research. Okay. Now remember where we were back 5 years ago, in January of 2020. We had this thing that was coming up. There were just a few cases around this time in January, mid-January. There were just a very few cases, mostly in China. Okay. We were trying to prevent it from coming into the country. We didn't know anything about it. We didn't know how it was spread. When it finally did hit here, people wouldn't bring their mail in because they didn't know if the mail was contagious. People were afraid to go grocery shopping. We had the kids out of school. We had, there was no vaccine. They shut the whole country down. Okay. The whole world was shut down. Okay. And think about what it did to the economy, what it did to kids in school. The only way to know how to treat that virus was to go through it. Okay. And the vaccines.
So you don't think that the herd immunity was a good idea because only about 1,800 people actually died in the city of Milwaukee after doing the research.
But
You know,
but a million people.
but we got millions that died
Yeah.
of I'm just thinking, is it a wise thing to send our people in as research monkeys? And you know, I hear these tests, these commercials ran all the time.
Hmm.
I hear them ran all the time on other stations, but they don't put their people out in front to push their people to actually, you know, like we do
Uh-huh.
in most cases.
But
So
keep in mind
my
too, big that keep in mind that back in Milwaukee was one of the first places where we actually discovered that African Americans were the ones that were disproportionately getting COVID.
Right.
Because what happened was not most things weren't tracking it by race. We
that's
decided
ridiculous.
our health department
That's
decided to discover, wait a minute, St. Joe's is having a whole lot of people. These people in the inner city are getting it. And so that's how we found these things out. So whether you want to be part of research or not, you can be part of research.
And
Okay.
I want to also add too.
You were over at St. Joe's at that
Yeah.
time, right?
Yeah.
Right. So listen. We talk about this. The first case of this stuff was done came up. We've seen it in Oak Creek. That was the first. That was the first deal in Oak Creek, right?
Mm-hmm.
And as our people, we are hustlers and we opportunists.
Mm-hmm.
Okay, black people are definitely opportunists,
Mm-hmm.
and we jumped on board right away when the stuff really wasn't being mentioned anywhere, and we became the black face. We became the face for COVID all over the country.
Mm-hmm.
And I was saying that to people, slow down, what are you doing? And we became the recipient of the COVID, of anything that COVID had to give out, man. We were the recipients of it.
Mm-hmm.
And that's why I just wanted to ask that question, because we have to realize, we always talk about Tuskegee, but
Mm-hmm.
Tuskegee has nothing to do with sterilization.
Right.
That works alongside of the birth contraception deal that sterilized Black Americans all across this country, man.
You know,
I
I would like to.
the phone. I just thought I would stir something
Okay.
up this morning.
Thank you, caller, for
Right.
calling in, and we can have more discussion about that. And one of our other shows, I think, Dr. Izzard, about research and what some of the challenges. But I want to make sure that we have time for our dermatologist today. And we have another caller on the line. Caller, thank you for sitting at the table with us. Good morning.
Good morning. My question is for Dr. Vaughn. You mentioned earlier about how people always think, oh, her hair is not moisturized enough, and that's not always the answer. What is the number of times, or how often should Black women wash and condition their hair? And then my second question is, what is like the number one product you recommend for us to use on our face each day?
These are great questions. As far as how often anybody should wash their hair, the should makes that a challenging question. In the past, we actually in dermatology had a lot of problems with the expectation and the creation of medicines around, that centered whiteness, basically. So people thought that, that everybody should be washing their hair every day, every other day. And so Black women would come in and they would get this shampoo that treats this dandruff condition of the scalp called seborrheic dermatitis. And they would be, told, okay, take this shampoo home and use it 3 times a week. And you can imagine that a lot of women of color were like, well, I don't wash my hair 3 times a week. I mean, for some women, when they do a proper wash, it takes them hours. And so, so only in the last, I don't know, maybe 5 to 10 years has this started to change, where we realize that women are, especially women of color, are not all washing their hair on the same schedule. And so when I have patients come in, I always ask them before I prescribe something that's for the scalp, how often are you washing? And then whatever they tell me, that's the number that I base my therapy on. They get to tell me how often to wash, how often they wash, and what works with their life. A lot of women, especially with certain hairstyles, don't wash their hair even once a week. And that's okay. I tell my patients, I might wash my hair once or twice a month. I have sister locks. I'm not in there washing. I wash it before I get it retightened, I wash it once or twice a month. And that's my number. I don't have a scalp problem. My hair is not too dry. That's healthy for me. My hair doesn't smell bad. It's not dirty. I rinse it in the shower, but to wash it is something else. And so when women have problems, I often will try to negotiate with them. Can you wash it once a week with this medicine? Because I think that's probably the minimum that it's going to take for this medicine to work. And that's a negotiation. So I think that washing it, the number that works for you, where it can fit into your lifestyle, you're able to wear the hairstyles that you like, and you don't have over dryness or over oiliness, that's the magic number.
Dr. Vaughn, that's really key. And I appreciate the caller calling in and sitting at the table today because that's always been a question for me. What is the amount of time that within a month that we should wash our hair? And you mentioned maybe once or twice a month is okay. And, that's good to know because a lot of us don't wash our hair every week because of the challenges that we have. Now, as far as moisturizing our scalp, what are your thoughts on that?
There are so many. Oh, and face. Yep.
Yeah.
Um, I mean, is it $1 trillion industry? It's $1 billion industry, like the cosmetics for the hair and face and moisturizers, sunscreens. These are, there's an abundance of choice out there. And I shy away from recommending very specific products. And part of the reason for that is because different things will work for everybody. Those products are formulated to like kind of work with certain body chemistries. And so a lot of times you just have to try a few things out and find what you like best. For hair, especially, I usually recommend that people talk to their stylist about what products the stylist would recommend. And the reason for that is, first of all, the stylists do that all day, every day. I'm a skin doctor. I'm worried about skin problems and fixing them with medicine. So it's not like I'm not a stylist, so I'm not trying all the products and knowing what's out there and knowing what companies are changing. But also, I want people to support Black-owned businesses. And sometimes those come in and they don't last, and so those are changing all the time. But there's a lot of really great Black-owned hair businesses out there, and I won't call them out by name, but you probably know them because you see them in like a segregated part of the store. But it's just fine. But I would use those ones that are made with your hair texture in mind. So products that are made for Black hair or textured hair. And then for the face, that is pretty, that's kind of universal. The the differences in skin texture that are dictated by skin color are actually pretty minimal from like a really microscopic level. So skin moisturizers, there's a million out there. You can use whatever you like. There's some dermatologic recommended brands, and those are the ones that have really worked to make sure that they don't have extra like preservatives and additives in their products. So things like Cetaphil, CeraVe, Eucerin, Aveeno, those are kind of readily available brands. As far as moisturizing on the face, the one thing I recommend for my patients of color that they're not always thinking of is get a moisturizer that has sunscreen built into it. Then you don't have to think about it and adding an extra layer of sunscreen. And the reason why to do that is because with dark spots, a lot of times women of color, especially if you get a little pimple or a little scratch, it will leave a dark spot. And many patients come to me asking, what do I do about these dark spots? How can I lighten them? And sunscreen is actually one of the best things that we have for that. We have new data that shows that even the regular lights in an office building can worsen a dark spot. And the only way to prevent that is by wearing a sunscreen that has iron oxide in it. So it has to have either titanium dioxide or zinc oxide. And so those are the ones that make you white and ghosty. And so for women of color, I also recommend get one of those kinds of sunscreens that is tinted. So at least it gives you a little color back. So it's not quite so white and ghosty. And that will be moisturizing and it will help you prevent against sun damage and dark spots.
Dr. Vaughn, we have another caller on the line.
Okay.
Good morning, caller. You're at the table. Thanks for joining.
Yes, ma'am. I'm back for that last piece of cherry pie down at the other end of the table down there. Please slide it my way. Thank you. Yes, Doctor. This is to the dermatologist. But good morning again, Karen and Dr. Izzard and Milwaukee. Tyrone W. speaking. Dermatologist, doctor. For men, male and female. I've still got a little bit on the sides here, and my chinny chin is good. what is the estrogen and the testosterone and stuff doing when the bald head goes bald, but the legs are still hairy and everything between below the navel is still hairy there. The lower parts,
Hmm.
bushes down there and stuff. So where the circulation cut off to where the woman and more for me, why is she going bald, but then she's got a force below the navel, and I'll just be
Oh
okay.
my
Thank you.
Say
goodness.
that. That's a pretty okay, doctor. Let's hear.
Yep. So, the hair on the head has a slightly different role than the hair on the rest of the body. And so it is slightly different in the way that it responds to changes in oil, to changes in hormone levels. And the hair is also kind of like this special place. It's kind of protected in a way from the immune system. We call it immune privileged. And so it kind of lives in its own environment. And, I have to think about why the hair on the head is so different from the hair on the legs otherwise. And I don't have a good reason for that, except that it does process androgens slightly differently. So, the hair loss that people have on the head is considered an androgenetic alopecia. So it is a response to changes in testosterone that are happening in the body. And when you start to look at testosterone and estrogen and the way that those can interact with even other hormones, like those that are uh, active in diabetes, all of these things work together. Hormones are so complicated. So, as you're aging, your body is changing. Fat levels are changing the amount of, like, your fat cells in your body actually process some steroid. They process some hormones. They have interaction with the androgen and estrogen in our bodies. And so, your weight can also influence your hair follicles. All of this it's really, there's so many causes and there's so many things that are within and without, outside of your control, that have to do with the hair. And so the the answer to why does the hair on the head change differently than the hair on the legs is a result of many, many factors. But it all truly boils down to how the testosterone in the hair follicle is acting. And that is why we have certain medicines that are active against hormones, against testosterone, that can help to regrow some hair. And the one that you'll see ads for on TV is finasteride. Um, I think that is sold as a brand name Propecia sometimes. They sell some, and then I think there's like a Him and Hers, I think, brand that was selling some finasteride,
Yeah.
and then you can get it as a prescription. That's the kind of right way to get it, is as a prescription. Um, and and so, yeah, the reason why that works is because it's actually blocking the conversion of some of the testosterone within the hair follicle. It's all very fascinating, and sadly, we don't have a magic bullet for hair loss yet, but things like minoxidil and finasteride can help.
Okay, thank you. We have another caller on the line. Good morning, caller. Thanks for joining us at the table.
Hello. Hello, everyone. Good morning.
Good morning.
I have a question for Dr. Vaughn. I've my son had an incident of dissecting cellulitis.
Cellulitis. Yep.
Yeah, yes, and I was just curious as to what the prevalence is among African Americans, because I learned that this is a condition that African American men seem to experience more. And what what can you do about it to prevent it or treat it?
Yeah.
And
Yeah.
I'll listen off air. Thank you.
Okay. Thank you. Thank you for that question. It brings up an important point that there are hair conditions that disproportionately affect Black men. And dissecting cellulitis is one of those. There's also a condition called pseudofolliculitis barbae, which we also used to call like razor bumps, where men would get these like bumps and dark spots after shaving. That's something that also disproportionately affects people with textured hair, so often people of color. There's another one, acne keloidalis nuchae, which is like the bumps on the back of the scalp that you'll often see. Sometimes your barber will be the first one to notice that. Dissecting cellulitis is a kind of alopecia, so it is a hair loss, and it is a scarring hair loss. And so it is something to be taken very seriously, because once that once, like I said, once those hair follicles are gone, they'll be gone forever. It is an inflammatory condition. We think that it is related to hidradenitis suppurativa, which is called HS, which is like people that get boils in the armpits and groin. And all of those things are things that you should see a dermatologist. If you have any of those conditions that I just kind of rattled off, you should see a dermatologist, because those are things that we have treatments for. I don't know the exact incidence of dissecting cellulitis. I'd have to look that up. I imagine it's probably, affects like 0.5 to 1% of the population at maximum. So it's a small number. Many more people get its cousin, hidradenitis suppurativa. But dissecting cellulitis, what it looks like, so people who aren't familiar with that condition, it kind of looks like bumps and sometimes pus on the scalp. It can start very small and it can spread and kind of be very destructive. And the great news is that we have better and better treatments for that condition as more research is done about hidradenitis suppurativa. So these days, in addition to putting things on the scalp for that condition, there are pills that you can take for it. There are even shots that you can give yourself for it. And that's the reason why, if you have it, you need to go see a dermatologist, because the dermatologists are the ones who manage those shots. And those shots are some things that you've probably seen ads for on TV, like Humira or adalimumab. A lot of times it's like a video, a movie, and then someone's dancing and their skin looks great. Like those shots, they actually can really work for conditions. And it dovetails with what the other caller kind of said about the COVID vaccine, and should Black people and people of color be guinea pigs for these research studies. And the fact of the matter is that that's the only way that our people get represented and get better treatments. So it's kind of funny. I think we sometimes want it both ways. We want, if we have a cancer, we want to be able to go in and know that the chemotherapy is going to work for people of color. If we, if we are losing hair, we want a treatment that's going to work for people of color. But then to do that, we have to give them the data. We have to tell them what works for people of color. We have to test things out in people of color so that we have that information when you need it. So we do have adalimumab, or Humira, is a treatment that will work for dissecting cellulitis in some patients. And so if your son is not getting better with the therapies that he has, it might be time to seek out a dermatologist and see about getting the injections.
Great. Thank you, Dr. Vaughn. We have another caller on the line. This is a hot topic today. Thank you for joining us at the table. This is Kieran, and we have Dr. Vaughn with us this morning to discuss dermatology. Go right ahead, caller.
Okay, good morning, everybody.
Good morning.
Okay, I was calling, and you were talking about hair, and I'm of course, a woman, and I've been through menopause. I'm 75, and my question is now, like, I had a problem with an adrenal gland, and I had to have it taken out, plus the kidney. And so the first thing the doctor asked me, I had to go to an endocrinologist. First thing they asked me was the hair on my face. I told them I didn't, I had hair, but I would cut it off. So I think it probably would be more, if your glands are off. But I was just wondering, would that have a lot to do with aging more? Because I feel I'm aging faster.
Yep. So a few things going on there. So your adrenal glands can cause hormone imbalance that can grow extra hair in places that you don't want it. That's called hirsutism. And so, people will get that hair on the face. People get that between the breasts, on the nipples, on the belly button, and kind of like going down towards the pubic area. So if you are someone who all of a sudden has grown a lot of hair in those unwanted places, that is something to talk to your primary care doctor about. In addition, growing hair on the face can be normal as we get older. So a lot of times, those hair follicles are kind of going through their own maturing process. And so they can sometimes become a little bit more robust, a little bit thicker, and seem to grow faster and faster the more you try to remove them. There are not great treatments for removing hair on the face. One thing, if you go to a cosmetic clinic, so not necessarily a medical clinic, but a cosmetic clinic, Frater and MCW has a great one. It's called Forme, F-O-R-M-E. And I trust the people there. They know how to deal with skin of color. And they have the right lasers to remove or reduce hair on the face in people of color. The trick to that, and what you need to know about it, is that it only works for dark hair. The laser cannot find light colored hairs. They cannot find gray hair. So if those hairs are already gray, then you can no longer do laser. Then you have to do electrolysis if you want to permanently remove the hair. And Frater does not provide that service. But there's also a cream that some people have used for hair on the face. And for that one, you should see a doctor to get that prescribed, because there is something that you might be able to do about that. But the other thing that's going on there that people should also be aware of is that when the body is under a lot of stress, like for example, you have your adrenal gland and your kidney removed, or if you have a very bad COVID infection or a hospitalization, if you go through a divorce, moving a house, losing your job, all of those things that put you under a lot of stress, even losing a lot of weight, like for these people who are newly on things like Ozempic, losing a lot of weight, your body just decides that if it's under a lot of strain, it's not a good time to put resources into hair. And so it will shut down. It basically shuts down the factory and just says, okay, no more growing hair right now. It puts all the hairs into like a freeze state. That doesn't mean that the
Thank
hairs
you
all.
very much.
Oh, okay. Time. Okay, time for a break.
Okay, that's okay. That you answered enough. Okay,
You know,
thank you.
yeah, Dr. Vaughn, I wanted to ask a quick question before we go to break. Dr. Izzard just texted me. He's on his way to see patients. He said, if cutting the hair does cutting the hair make it thicker?
Um, no, not. I'm going to go with no on that one.
Okay.
As a general answer, just in the interest of time.
Okay, no on that for cutting the hair and make it thicker. This is Karen Dotson with the All of Us Research Program at the Medical College of Wisconsin. We have Dr. Vaughn, who is a dermatologist at the Medical College of Wisconsin. We're at the table today, and we thank you for listening and calling in. Please feel free to continue calling at 414-444-5250, 414-444-5253. We'll see you back on the other side. We have maybe about 10 more minutes with Dr. Vaughn. And Dr. Vaughn, thank you for joining us this morning.
Thank you.
The passing of a loved one is emotional enough without adding the stress of funeral arrangements. By pre-planning, you receive the desires of your heart while taking away the burden from your family. It also saves you money, providing the dignity and respect your memory deserves. And there are times when life ends unexpectedly. Please know that the New Pitts Mortuary is here to lend a helping, caring hand anytime, day or night. We are the New Pitts Mortuary.
everybody back. This is Karen Dotson from the All of Us Research Program at the Medical College of Wisconsin. And I have with me Dr. Vaughn, who is a dermatologist at the Medical College of Wisconsin. And Dr. Vaughn, we have a few more minutes, I should say, with you. And what would you like for the community to know about the best things to do for our, in a summary, because some people are listening in and out. What are the best things to do with for our hair and our skin that, especially for people of color, black and brown people?
Actually, thank you so much, Karen. You know what? This is perfect timing because we are having an event, and people who are not sure about what might be going on with their skin and hair can come to our event. It's on March 1st. It's at G's Clippers. G is the barber to the bucks, and he has this amazing barbershop down on MLK or on North. And we have this event on a Saturday morning where we do what's called a skin, hair, and nails educational event. It's not a cancer screening. We used to do a lot of cancer screenings, but that actually serves mostly white skin. And so I have stolen the idea of a skin screening and turned it into an educational event for people of color and holding it at a barbershop because people of color do have so many questions about hair. And so, we were talking about, a lot of, women with hair loss, a woman whose son has a hair condition, and you might just not know. And it's, right now, if you call to get an appointment with a dermatologist at Freighter, you might be waiting many, many months. So this is a great opportunity to kind of skip the line and come in and just get like a very preliminary answer to, is there an issue here? It's a quick in and out. It's not like a full exam by any means, but you can at least find out if you have a problem that needs to see a doctor. And so that's at G's Clippers on March 1st in the morning. And so I would recommend people do that as a starting point if they aren't sure if they have a question, if they have an issue, or talk to their primary care doctor. And it's always so important. I just want all of the people of color in our community to have a primary care doctor that they trust. If Dr. Izzard was here, I know he would still, he would echo me on that same thing. Just that you need your doctor to be your ally. You need to take care of your health so that you can go on being a vibrant part of our community. And so please have a primary care doctor. And then the last thing that I want to say, just a labor of love from my heart, is that I actually take care of a lot of genital skin conditions. So a lot of problems down under, vulvar skin problems. And I have a special clinic that takes care of the patients with those problems called the Mucosal Skin Clinic. And I don't see a lot of patients of color in the clinic, or at least not as many as I would like to. I want it to be so many because I want to care for, my people in my community, of course. I want to care for everybody. I care for everybody equally. But I sometimes wish that there were more people of color in that clinic. And I know that women of color in Milwaukee have problems with their genitals because, of course, they do. It's skin just like everywhere else. So I just want to encourage women as well. If you have a vulvar skin condition, please think about getting that also checked out, ideally by me, because that is something that I really care about for our women in our community. And then I do have one just last shout out to you, Karen Dotson, because the All of Us program is so important. I don't know if people know kind of what a boss lady you are, being the program director for that program and raising the awareness of it in our community. It's so cool. And I hope that people, when they hear you speaking on the radio, really do take seriously the opportunity to get involved in research, and that is a way to give back to your community, to your grandkids, to the future. So thank you so much for the work that you do there.
Thank you, Dr. Vaughn. It's really been a joy. I know you are so busy, and the institution uses you a lot because of the limitations of, as far as people of color, but also your patients. And I'm actually one too. She sold me on it, and and I just love it because I've gone to other dermatologists before, but it was something about going to you that really made a difference for me. Even, the types of creams that you provide, and, you kind of give a nice formula and put things together and they'll ship things to your house. And I mean, I never had that happen before. And I was just so impressed with that. Because you really took the time to know about the type of skin and what needs to happen. And if it's not quite right, you tweak it a little bit more. And that was something that never really happened for me, going to multiple different dermatologists before. And so I wanted to say thank you because, you really make a difference. And it does take a while to get in to see you, but you make such a difference in helping people of color as well. And I know that's not
Thank
the only people
you.
that you see because people are lined up to see you because you are just good at the work that you do.
Thank you.
One thing I
Thank you
wanted
so
to
much.
ask you that you really didn't speak on is that you mentioned about global health. What exactly are you doing in that area?
Uh, well, I wish that I could do more of it. I wish I had more time that I could, jet away. I have a couple young kids, so it's kind of hard to get away during the school year. But I've done some global health work primarily in Vietnam, and then I have family that's still in West Africa, Nigeria and Ghana, and so I'm, working on trying to do some global health work there, and then always, working with global partners to raise awareness around vulvar skin conditions. There's, they say, think globally, act locally. And so I also think that some of the work that I do right here in Milwaukee, especially to immigrants who come from some countries that are dear to my heart, I think of that as global health work now as well. We have refugee populations that are here. We have, prison populations. And that I think is also kind of like looking at dermatology from a global perspective. And I love all of those things.
This has been a joy for you to share your knowledge with the community. Thank you for joining us today. Don't forget, Dr. Vaughn mentioned that she's going to be at Jean's Clippers on March 1st. That's a Saturday, actually the first Saturday of the month, March 1st. And she's going to be there, and you can have a one-on-one to talk with her, and she can, briefly see you. I'm thinking that people are going to be lined outside the door now, Dr. Vaughn.
Maybe it's
Because
a
with
good problem to
people
have.
like I know, you better be there because that might be the only time you get to see her. It might take a whole year because that's how really backed up she is right now. And so, thank you for taking this time out of your busy schedule. And I look forward to hearing the great results of March 1st as well.
Oh my gosh, thank you so much for inviting me, Karen. This is just, it fills my cup. It is such a joy to be here. I really appreciate the work you're doing.
Thank you. You have a wonderful day.
Thank you.
And now I would like to kind of change things around a little bit. Um, we have on the line, well, first of all, I wanted to mention that this month is also nationally Blood Donation Month. And because of that, I really felt a need to bring to the community the importance of blood donations. And so I have Kristen Harris. She's a senior community outreach manager at Versity. And so, Kristen, welcome. Good morning.
Good morning. Yes, thank you. Thank you for having me.
When I saw that this was the month for blood donations, I said, we got to get you on. And I know you've had some
Yeah,
conversations with our staff and our team. We've been partnering with
absolutely.
you guys, having some tabling and things like that when you have
Yep.
special events. So we want to thank you for that. But also,
Yeah.
Christian, what do you want to say to the community as far as the importance of African Americans as it relates to blood donations?
Well, I would say, as it relates to African and Black Americans, it's important. In our new location, Versity on King, we're inside the Thrive on King building. We're a first floor tenant there. And it's important for us to be in the community. So when we talk about diverse donations, building trust with the Black community with donations, we are a part of healthcare. And there's a lot of, hesitancy when it comes to Black people and I don't want to, donate blood. I'm scared of needles. I don't trust needles. So it's important for us to be there. But then when we think about, matching matters. And so diversity and donation is really important for improved patient outcomes. As we think about some of those rare and uncommon blood types, they're often found in similar ethnic populations. And your blood type is inherited. So if you're compatible with a donor that is usually someone of an ethnic background as yourself. So being in this location in the Thrive On building in the heart of 53212, we really need to make sure that people are educated on what blood donation is, where your blood goes, why we should be donating, and just ensuring that people understand, some of the importance of some of these diseases that affect communities of color, blood diseases that affect communities of color more than, some of our other ethnic backgrounds. So you think about sickle cell disease and lupus. Of course, cancer affects everyone. Diabetes, those typically affect Black Americans and African Americans at a higher rate than, maybe our white counterparts. So just getting that education out and helping Black people really understand the importance of donating blood and where your blood goes and who you're really helping and getting our community healthy. So, it's really important for us to show up.
So, Christian, I have a question for you. For someone who
Mm-hmm.
wants to donate blood, if I
Yep.
walk in, tell me what to expect. Walk me through the process a little bit. Give me some idea.
Yeah, sure. Yeah, sure. So we have several donor centers throughout Milwaukee. The one that is probably closer to some of the viewers or some of the listeners on the line is our Versity on King location. But basically, you can walk into our location. So we have walk-in opportunities, and we also have versity.org. You can go there and look up, the location closest to your zip code, and you could register to donate. So once you get that situated, if you come in and donate as a walk-in or you register, we ask that you eat breakfast or have lunch before you come, some type of meal, that you're hydrated, you drink lots of water. And basically, it's a 30 or so minute process from the moment you walk in to the moment you walk out. So when you come in, our phlebotomists are great. They'll make sure you're comfortable. There'll be a series of just a few questions about your medical history. It's kind of like a mini physical. You'll be weighed, we'll check your blood pressure, things like that. And then we'll bring you out to the floor and we'll get you set up in a donor bed. And we have, TVs and we have radio playing, whatever makes you comfortable. Some people bring in laptops and work. And our phlebotomist will, sit there with you through the process and walk you through, every piece of you sitting in that chair. So it's really a seamless process. Once you're in the chair, it's probably a 15-minute process to donate blood. And then after that, we will set you down in our kind of cafeteria area. We'll give you some snacks, make sure you're, again, hydrated. And then, hopefully we'll get you rebooked with your next donation. And all that being said, you must be 17 years of age in order to donate. You must bring an ID. If you are 16 years of age, you can donate, but that's with parental consent. And we have those parental consent forms. So if you're able to donate and willing to donate, please come to any of our donor centers and donate and help save a life.
So I have a question for you. Can someone with sickle cell trait donate?
Yes, you can.
Okay.
So that's been a question for a while, is like, can you donate? Can you not donate if you have sickle cell? So years ago, it was kind of like, if you have sickle cell trait, it's a no. But now with improved, medical information and research and things like that, we've learned that people with sickle cell trait can donate, but it all depends on how healthy you are. So just, again, with that coming in for your donation, you will go through, just a mini physical, and just depending on how healthy you are, you can donate. So all that is taken into consideration. So I always tell people, try to come in and donate, because we do know that sometimes people can't donate due to high blood pressure, low iron. All that stuff is taken into account when you come in and meet with us, with our phlebotomist, for your medical review. So yes, yep, you're good there.
So when you mention about the low iron, do you guys do a test on that, or you just go by what the person tells you?
We do a test. Yep.
Okay. So
there's a finger prick. They check your iron. They check your blood pressure. They ask you a few questions about your medical history, some of the medications you're on, and then they go through that process. And then, depending on how that outcome is, you can donate, or sometimes, some people may be deferred, because we know in the Black community, there is a lot of high blood pressure and there is a lot of low iron. And so, we just ask that people try to come in and donate. And an added benefit, I would say, Ms. Karen, is at our Versity on King location, we have a community health navigator who sits at this location. And if you are, for whatever reason, unable to donate, high blood pressure, low iron, you can go right into her office. She accepts walk-ins, and she can walk you through the healthcare system and say, you know what, your iron was a little low today. Do you have a primary care physician? And if someone says no, she can help you navigate the system and find you a healthcare provider, find a dentist, find an eye doctor, mental health resources. All these things are on site to help get our community healthier, so they can donate, so they can be healthy, so they can be a productive member of our community. So that's another added benefit at our Versity on King location is our community health navigator.
You mentioned the King location. Can you give that address? Because we make assumptions
Yeah,
that people kind of know the Thrive On building, and not everybody is knowledgeable about it. So go right ahead.
that's true. Yeah, it's 2153 North Dr. Martin Luther King Drive. It's kitty corner from G's Clippers. It's the old Gimbel Schuster department store that's been refurbished. So beautiful building, lots of rich history. You know, I offer up tours all the time for people to come in and see our location, see our donor center, meet our phlebotomist, get comfortable with us, meet our community health navigator. So all of that is available if you'd like to come and visit us.
And then also, Kristen, what about people if they want you to come like to one of their events or locations? Do you offer that
Mhm.
opportunity to provide that
Absolutely.
service?
Yeah, absolutely. So yeah, you can reach out to me. My email is KA Harris at Versity, VERSITI.org. So KA Harris at Versity.org. And just let me know what type of event it is, what time you'd like us to be there. If there's any specific information that you'd like us to provide, you know, we have phlebotomists, we have laboratory teams that could come out and talk about job opportunities. We have just overall health education around, you know, our community health navigator, getting people through the healthcare system, and anything else that, you know, you may want us to talk about. Focus on blood, focus on organ and tissue donations. But yes, we do tons of tabling opportunities throughout the community. So please reach out. We'd love to work with the community.
And why is it so important for people to know their blood type?
It's important for people to know their blood type, especially, you know, I tell people all the time because we have blood typing events that we host at Versity on King, because there's a lot of people walking around who don't know their blood type. And when we think about the sickle cell trait, for example, you know, if you have the sickle cell trait and you know, have a child with someone else that has the sickle cell trait, you're more than likely going to have a child that has sickle cell disease. And so people don't, you know, there's no blood test sometimes before marriage and things like that, before children. And so people don't even know their blood type. So you could be passing down something to your child that you don't even know you have. And so instances like that, when we think about sickle cell disease, you know, and just even if there's a tragedy, you know, you're on the ambulance and they ask you your blood type, if you're able to speak, you know, just being able to say, hey, I'm O positive. So they know right on hand, because, you know, the ambulances have blood on hand. And so if they can know your blood type right away, they can help you as well. So just knowing, you know, I think it's good information to have on hand, because I've met so many people who are like, I have no idea what my blood type is. And it's not like you can really call your doctor's office and say, hey, what's my blood type? You really have to give blood in order to learn your blood type. So it's important for us to know.
You know, when I was talking with you yesterday, one thing that you mentioned
Mm-hmm.
about various careers in phlebotomy and some of the things that you all are doing in that area. Can you speak to that?
Yeah, so especially I'll continue to talk about Versity on King, but Versity on King, we moved our training room to Thrive on King. So right next to our donor center, it's a glass room. People walking by can see people in scrubs actually learning to become a phlebotomist. And so they go through all the medical history, all the questions about, you know, what a phlebotomist does, what it entails in our training room. So if you're hired as a phlebotomist in Wisconsin, you're trained at Thrive on King. So we're making sure that we're hiring from the community, especially being at Versity on King and in our Thrive on King location. We want to hire from the community. We want representation. We want phlebotomists who represent the communities that we serve. So again, you know, we're really trying to build up our employment as far as phlebotomists, but also, you know, our headquarters is on 18th in Wisconsin, and we have a variety of opportunities at headquarters too. You know, we have a lab and a research institute over on Watertown Plank Road on the Freighter and Children's Campus. So at that location, we have, you know, researchers and investigators who investigate all different types of blood diseases and are trying to come up with cures. And, you know, people come from all over the world to work at Versity at our research institute. It's really world renowned. So lots of opportunities. And if anyone is interested listening in a career at Versity, please check our website, versity.org careers, and, you know, see what's out there, and let's get, you know, people hired.
I love to hear that, because I know that looking for a phlebotomist with a diverse background sometimes is very challenging. And some
Yes,
people don't really know what they can do to move forward in that career. So thank you for sharing that
absolutely.
information with us. When you've been
Absolutely.
working in the community, what is one of the biggest challenges that you really see or face for the Black and the Brown community?
Oh, the biggest challenge is they don't trust healthcare. And for all, I get it, right? You know, they don't trust healthcare. We are a part of healthcare. We are people with needles. And so, you know, we hear a lot of, well, my so and so, my grandma, my parents, my aunties told me about the stevia experiment. What's in that needle? You know, and we're like, we're not putting anything in the needle. We're drawing your blood to save lives. So we hear a lot of that. We hear a lot of I've seen men, you know, who people are afraid of needles. You know, they're scared, you know, big men, you know, with big old muscles, like, I don't know if I can do that. You know, so it hasn't been ingrained in our culture to donate blood. Whereas some other cultures where it's like you start donating blood as a teenager in high school and you carry that throughout. In our culture, it's kind of like, I don't know about this. So we really just have to educate people on, you know, looking at the tragedies that happen across the country. And then we look at the news every day in Milwaukee, and, you know, people are getting shot, stabbed, car accidents. 9 times out of 10, those people are going to need blood. And so blood cannot be manufactured. So I've had people come up to me at events and said, you know, I didn't give blood until my child had X, or I didn't give blood until my husband was diagnosed with cancer. So I think a lot of times in our community, we wait until it hits us and now we want to give, which is great. But I would love for our community to get to the point where we're giving just because we want to help our community, not because it just specifically hits home for us. So I think we just have a lot of work to do, and us being, you know, in Thrive On building and a community resource hub, really close to, you know, a lot of different organizations and churches and schools. We have a great opportunity to get that education out. So hopefully we can get the work done.
No, Christian, just wanted to ask you, we're getting ready to kind of wind things up. Is there anything else that you would like to say to the community before we conclude with your interview today?
You know, I would love to say for anybody listening as a community member, or if you are an organization, church, school, please reach out to me. I would love to work with you to get education out to, you know, our community of the importance of blood donation, the importance of sickle cell. I give tours all the time where people and organizations come through and they get to see our space at Versity on King, and they get to meet our phlebotomists and hear from our phlebotomists who are of the community. So at our donor centers, we work really hard to get our phlebotomists to be a representation of the community. Our phlebotomists at Versity on King, most of them live in the neighborhood. So they can talk about their journey at Versity and how they became a phlebotomist and what they see and hear. And so I would love to open up the conversation. I would love to partner with, you know, the listeners on the call. So please, you know, give me a call. My work cell is 414-235-7761, or you can email me at kaharris@versity.org, and let's work together. Let's get this education out because it's important.
Christian Harris, thank you for joining us today.
Thank you.
She's a senior community outreach manager at Versity. This has been a wonderful, wonderful show today. We had a lot of diversity involved in the show today. We talked about different types of uh, research that's going on right now. We had wonderful conversation with Dr. Bond related to dermatology, and then we also had a wonderful conversation with Kristen Harris from Versity Blood Center. So everybody have a good weekend, okay? Go out, do something positive. Also, take care of yourself. We try to bring information to you that's going to make your life a little bit better. And please let us know, what else would you like to hear from us? We always are open to it. So everybody have a wonderful week.